Hello and welcome to the Smart Connections podcast and the Talk the Path podcast. My name is Anna Sanderlin. I am a warm-line facilitator for the University of Memphis Smart Center. The University of Memphis School of Social Work Smart Research, Training, and Treatment Center aims to provide evidence-based interventions for school-based mental health programming, increase access for school-based behavioral health programming in underserved areas, offer training on best practices in telebehavioral health, develop opportunities to research the use of technology in practice, and provide direct services to the state's most vulnerable populations. You can call the Smart Center at 901-678-1636. The University of Memphis Smart Center, in conjunction with the University of Tennessee, Knoxville, and the Tennessee Department of Mental Health and Substance Abuse Services, would like to present the Pathways to Behavioral Health Careers Project. The goals of the Pathways Project are to provide education and information on the various career opportunities in the field of behavioral health through presentations, increase interest in students in the field of behavioral health, provide opportunities for guidance with information regarding college, university programming that result in degrees for professions in the field of behavioral health, connect students with students in behavioral health programs and professionals in the field for further research. This podcast will feature students and professionals in the field to give a clear picture of the daily duties of these roles and how they help support their communities.
All right, hi, welcome. I'm Christy Peterson. Thank you so much for joining me today. If you'd like to give your names.
Yeah, okay, so my name's Belle Tate, and
I'm Garrett Payne.
So we are from the College of Public Health at East Tennessee State University, and we both have a concentration in community and behavioral health.
So what motivated you to pursue a degree in public health and in those specific public health interest areas?
So I would say for me, in high school, my elective focus was health sciences. And so I knew I wanted to do something in the healthcare field. I just didn't know what that was. So I ended up getting my CNA license my senior year and tried to, figure out what kind of healthcare I wanted to be in. And I found out that hands-on patient care was not going to be for me. And so I came to college trying to think, what's something that I could do in the healthcare field, but not necessarily have to be directly with, patients in the hospital setting. And so I got with my advisor and started looking around and what my interests were. And, public health and behavioral health in specific was, something that stood out to me because it was a way I could still get out there and be active and, help people, but I didn't necessarily have to get my hands dirty.
Started out in biology as my major. After doing just one semester of biology, I realized that probably wasn't for me. And I had a friend who was in the College of Public Health, and they told me all the classes that they were taking and the stuff that they did within the university, and I thought that was a very exciting opportunity. So I just decided to switch over and transition from biology to public health, which is a much more generalized field, much more opportunities and jobs within that field. So that's how I got into it, and I've loved it ever since.
Oh, great. That's great to hear. I am very impressed that you both knew early on, specific areas that you wanted to, go into, even though those initial areas turned out not to be, where you wanted to be, and you were able to find, your space here and now. Because I do hear a lot of individuals who kind of go in it with a, general sense of what they want, but to know you've already had a CNA license and, biology is certainly a field that I stayed away from because it's not very easy, in my opinion. So I'd love to hear that you utilize resources like your counselor and, were able to, kind of find your new area of interest and focus. And I have to say, it's so important to hear you say direct service, just wasn't for you. I think a lot of people wouldn't really say that kind of early or out loud, because sometimes it's seen as such an altruistic thing, right? Helping people in that way. But it really is, a lot of work and it takes, a certain type of person. So kudos for you for realizing early on that, this is not where my help should be. So I'm really glad to hear that. And I know many others will probably have a light bulb turn on for them, like you both did, where, it's just not, exactly where I want to be, because we have all, I think, fell victim to staying somewhere too long or working on something too long.
Yeah.
And, before you know it, so much time can look up and pass where you've kind of missed out on giving in a way or working in a way that best suits you. So love to hear that you were quickly able to pivot. My next question would be, how do you define behavioral health and why do you think it's important to include it in public health programs?
That's a good one. I would define, I would define behavioral health sort of as an umbrella term, that sort of includes a lot of things. And I think it's different for different people, but for me at least, it's, I think about mental health when I think about that. It's sort of, I think of the, I can't remember what it exactly is, but, you've got spiritual, mental, all these types of well-being. And I think that all plays into behavioral health. It depends on your, your background and your family, your support system, all these things factor into, your behavioral health. So to me, it's more of something that is made up from, the way you grew up and the community that you live in. And, just your encompassed mental health, if that makes sense.
Okay, so I certainly agree with everything that Garrett said. I believe that behavioral health is more or less defined by trying to improve or change someone's behavior to overall impact their health for the better. Yeah, I agree that it's overall more umbrella. That's probably how I define behavioral health as well.
Oh, I agree wholeheartedly. And I am so happy to see that there is a shift in viewing it that way, that it encompasses a lot of different areas of need that can be defined by, health as a general label. But as you said, there are different areas of need that traditionally weren't included. Thinking about people's cultural needs, how that affects their mental health, because there are certain asks and responsibilities that weren't included in screeners that, the brief screeners that we use and things like that. People's spirituality, that certainly can add both beneficial factors, but also stressors because of, things that their religion asks of them that they may not be unsure of, or as they, have more varied experiences and there may be a bit of a disconnect. Those all can create behavioral health needs that I think we, missed during periods of our history as this field grew. And so I love that more and more individuals are trying to make sure that they get the right programming, the right training, the right hires to ensure that we are thinking about all of the vast needs that, make up behavioral health, and to include it in programming and school curriculums now are ensuring both the practitioners that come out of schools or the researchers or the clinicians, they are, more apt at including this in their field or their private practice, or, pouring into others that they might have interactions with, whether it's teaching, whether it's mentoring, whether it's providing services. So we're, getting a full, more well-rounded set of offerings. So I'd love that, thinking of it that way as an umbrella term. And certainly now more and more individuals and more entities, more and more schools are recognizing the need to have it as part of their curriculums. I agree wholeheartedly with that. The next question we have is, in what ways do you see behavioral health intersecting with other aspects of public health, such as epidemiology, and health policy?
So I would say I'll touch on health policy, and I bet Belle will touch on epi. That's one of her minors. But for health policy, at least, I think it's something. Health policy is something that people don't really think about when it comes to healthcare. Everybody just thinks about, again, the nurses, the doctors, the hands-on, what will they do? Because I don't think a lot of people realize, what all goes on behind the scenes and how much that actually affects, patient care and stuff. But I would say public health as a whole, where we're taken into all these aspects, like we talked about culturally, spiritually, physically, mentally, all these things are key elements of public health. And so to me, public health and behavioral health, not necessarily are interchangeable terms, but I think about one another when I think about one. When I think about behavioral health, I know that is, something that's in public health that, is deeply rooted in what people need and what people do. And then public health on vice versa, it's one of those umbrella terms again that encompasses behavioral health. But I think, as far as policy goes, making policies that we know are going to be able to impact people's behavioral health, implementing policies that we know we're going to, whether it's trying to help them recover from addiction or, whatever it is that we're doing, if we can implement these policies based on the results from what we get, rather than just, whether that's about making money or, whatever it is, and focus on really the behavior change rather than anything else.
Right. Completely agree with that as well, because I think I was having a conversation, oh my goodness, several months ago where we talked about policy can help protect against bias, right? If you help develop policy that is for the greater good of the community versus, let's say, capitalistic dreams where it's more about making money or, fiscal interests, then some of the biases that affect people's behavioral health needs are inoculated because you've got policy that is protective, you got policy that is progressive. And so I have really been impressed with how public schools, particularly here recently, the School of Social Work here utilize, the local voices to inform people about a proposed policy change that was coming down from the government. And I think using, different platforms, I think being a part of national associations, of course, using National Day on the Hill, all of those different mechanisms to make sure policy remains for the greater good of society as opposed to a very targeted, limited focus can help, increase behavioral health outcomes, because then decisions are based off of what's the best need, what's the best treatment, what's the best intervention versus how can we provide a service at the least cost to, the companies that unfortunately tell us when and where we can get services and for how long. So I do think that those intersect very intricately. And I think, both of them can be used to kind of drive, the best practices in terms of, the policy that's highlighted, adopted, which of course in turn drives our direct practice continuum. What about you? What do you think?
So I agree wholeheartedly with what Garrett said already. I do believe that behavioral health is a field of public health. Public health is a very generalized and broad term, as we've already said before, whether that be talking about vaccinations, policy change, road conditions, anything that contributes to one's overall well-being, whether that be mental, physical, spiritual, etc. But I never really thought about how epidemiology and behavioral health intertwine up until I got involved with this project. So when you really think about it, the first thing that comes to mind whenever I think epidemiology is sickness, illness, disease spread. And you always associated that with a actual illness such as for example, like the flu, like where it spreads and how it spreads and transmission and stuff like that. But you never really think about how mental health would play into epidemiology, the background of somebody's mental health, the growing up and the upbringing, and just the origin of how they are now.
Oh, yes. I'm not sure I thought of it in that way either until, this project or, conference attendance, how, health is affected by, environmental factors, how it's affected, access points. Like there's so many things that go into the type of things you kind of have to worry about that you might be predisposed to genetically or environmentally or situationally. And all of that can be addressed by having a more informed, behavioral health perspective, a set of resources. And again, as we stated, protective policies. And so to see, more individuals grouping up, to see more advocacy in that area has, really been a promising thing to see. And I love that more and more people feel comfortable speaking out about, places and situations and times that have caused particular issues so that we can learn from it and make those necessary changes moving forward. I'm not sure there's been a time in history where, we can use things like social media, we can, use collective grassroots organization and organizing to get people to understand, some of the things that have long been happening that have to be addressed, and things that have been in place that limited like access, that limited, individuals' ability to really work on their healthcare. But now you've got full-fledged organizations that's all they do, taking the charge to ensure that, we've got the right things in place to provide the right services. So I definitely am thankful for this project for allowing us to, see how they should cross-sect and how we should be using these types of platform in this way. Another question I have is, how do you think cultural factors influence behavioral health beliefs and practices? And how should public health professionals take these factors into account?
So we both had to take a cultural competency class as it's required for our major. And one of the reasons it's required is because, as public health officials, whatever you like to call us, we have to, when you're serving the public, you have to understand how many different people are in the public with different backgrounds, lives, and different everything. No one person is the same. And so that's what can make things challenging. And so, especially when you're talking about cultural backgrounds, a lot of the big things that we learn there, like in the Muslim religion, female patients aren't allowed to be touched by male physicians. It's little things like that to, someone, if you don't know, could have a huge impact on their behavioral health. I mean, one wrong move like that could, completely shift somebody's whole reality. So just being aware of the little things like that, and understanding that, you're not the only person in the world, and that people are, different from you. And when you're in, you have to be in a position of neutrality, really. I mean, you can't take your personal opinions into things especially when you're working with the public in that capacity. I think it's really more about respect than anything. Just trying to understand that there are different people with different beliefs and different ways of life that you have to be able to, adjust to and work with, so that you can do what everybody needs rather than just what a particular group needs.
What about you, Isabelle?
While we've been giving these presentations across schools in East Tennessee, we have seen a difference in high school students understanding what cultural competency is, which was surprising to me because I didn't understand it until I went to college. But I've learned that cultural competency is more or less just being tolerant of somebody else's beliefs and their background and their walks of life, and just how they believe. So you can give them the proper form of treatment, whether that be, once again, having a female physician touching a Muslim patient rather than a male physician doing the same thing. But so I think cultural competency is very important in treatment and behavioral health and in public health, just because you can't expect somebody to listen to you and listen to what you have to say about their health if you don't have the respect between the two.
Right. Absolutely. I too didn't get a lot of exposure until, college and working different jobs about the relevance of cultural competency in both, professional and social circles and things like that, to help me gain understanding. You essentially need to be open to learning the entirety of your professional career, because, there are certain cultural considerations that we know across ethnic groups and backgrounds. But with the expansion of just, like you said, more tolerance, with people breaking away from some things in their culture and interacting with other cultures in a way they haven't before, there are new things that are being forged all the time. And so, you go in with an open mind, essentially saying, how can I be of assistance? How can I respect your needs? How can I respect your wishes? And I think certainly, there are things that are helpful that we've used traditionally, like screeners that have been regulated and peer reviewed to, utilize across populations. But I think, as emerging data tells us, there are new trends, there are new things that are going on, or there are new, like worldwide issues that affect cultural groups in different ways, then that's when you go back to the drawing board. Do we need to add a different set of considerations and questions? Do we need to engage certain cultural and ethnic groups in a different way and to hear what they say, hear the types of things that they're experiencing so that we can adapt, our service engagement practices or do we need to shift the particular types of services, the time of day? So there's just so much to consider, as you make your way through, your collegiate career or as you are adjusting your professional practice. So I absolutely agree that it is something that is very important, very relevant, and it helps us decenter ourselves so that we can provide care that is, worthwhile and beneficial in ways that people haven't seen in the past. I'm really happy to, see that, of course, as a person of color, because there are times in history where, access wasn't always available, or sometimes you would go into situations just unsure of what type of care you receive. So to hear so many more people shifting towards openness and, particular sets of training really makes, it more comfortable for me, personally when I go to the doctor and as a professional who also wants to provide that type of care and to see individuals like you all going into class and having these courses that are opening all of our minds to, the existence of a different set of needs. It's really heartwarming to think about, a whole new set of generation that's going to be able to provide a different level of care. And then, of course, make healthier, happier people for a better society overall. So let's all sing Kumbaya right now. But yes, no, I do love to hear that more schools are being open and including those types of, educational opportunities for us across the spectrum. So one of the last questions I have is, what strategies do you think are most effective for promoting mental health awareness and reducing stigma within communities?
I know it's going to sound cliche, but just talking about it,
Oh,
really, I think that's the biggest thing, is especially for the male population. It's just you don't talk. You know what I mean? Like, as if that will make it go away and not make it worse. But I think that's the biggest thing is really honestly just one, acknowledging that, it exists and that, people have feelings and, that people have mental health problems. And, I would say two, recognizing that mental health is just as important as physical health. And, it's one of those things, again, that they really impact each other so much. You can't have one without the other. Your physical health impacts your mental health. If you don't feel well, you usually don't feel good in your mind either. Or if you're struggling with something in your head, it can physically make you ill. So, I would just say making sure that people know that they can, express how they feel without having to worry about judgment. It's really not that hard to listen to somebody, and that's most of the time just what people need, is to just talk about something. They don't even necessarily need advice. They just want somebody to listen to them. So that's honestly the biggest thing that I've found, is to just, when because you can tell when people are struggling. Not everybody, but just having genuine conversations with people and, the reassurance that you can give them, I would say, are the two biggest things.
Mm-hmm. Absolutely. Talking about it has been one of the, best interventions that I think we have available to us in reducing and eradicating stigma around mental health struggles, because you are understanding that you are not, isolated in something that is, dysregulating to you. I think, there are, especially like you said, since we, of course, being honest, we live in a patriarchal society And we do have some now deemed archaic notions about how men can express themselves and their needs. So being able to have, supported, facilitated conversations about mental health needs with that particular group, I think is a huge, boost for people being more comfortable talking about it, people being more comfortable reaching out for help in ways that we haven't seen before. And then, of course, with the advent of, technology and the uprising in the use of telehealth practices where people can be more comfortable, reduce a lot of the barriers of getting into an office. So it makes those conversations, right, more readily accessible and, able to happen at higher rates. So and that's something that even though it's the simplest and like you said, it sounds cliche, it's never really happened. There's not been a full-fledged effort to publicly share and talk about struggles that we have in that way. And that's one of the best ways to push back on, a lot of problems we see with people, reaching out to get help. And your thoughts?
I don't know about you, but I mean, I feel like even in the 4 years that I've been in college, it seems to me that talking about mental health at least has exponentially grown. I feel like when I came here, it's still more taboo, but I feel like at this point, like most, at least on our campus, at least, I know a lot of people who are very open about their mental health.
I was going to say some key strategies that we could probably utilize would definitely be through social media. I feel like it relates more with the teenage population, especially through Instagram and then Facebook. It's all age groups. Everybody uses it, it seems like. But just promoting mental health and destigmatizing mental health on these platforms would definitely push us in the right direction of destigmatization overall for mental health. But I feel like day by day we see an increase in people talking about their mental health and their mental health needs and how they actually feel. I feel like the younger generation is a lot more open to how they feel. My mom's a teacher and my dad's a principal, and they hear conversations every day within their schools about how a student's feeling and just the support they're getting from their friends. Sometimes people are a little too open to the wrong people, but at the same time, it's great to hear that people are willing to talk.
I have a question for you on the topic, and it was something that I was talking to somebody about the other day. How do you think, I think the only problem that really we have with talking about mental health is that some smart people have realized they can use it sort of as an excuse. You know what I mean? They can, they might not have any mental health problems, but they could, whether that be a manipulation tactic or, they realize it'll get them out of something. And so how do you determine who's being genuine and who's using it as an excuse, and how do you deal with that?
Right.
I think that's
that's a good question. I do agree that in the day and age and era of social media and platforms and gaining, power or monetization of platforms, individuals will often adapt what they think are certain sets of behaviors that gains either empathy or, more awareness and for personal purposes versus behavioral health needs. So I think, we push back on that by ensuring, we are just as media savvy as those individuals by providing the right set of information from peer-reviewed sources, from journals, from what we're learning in classes. We create spaces that are staffed with facilitators who are respected, who are revered, so that there's not limited access, so that, we're talking and pushing them towards the right sources. And then we're open about that. As you said, I think we have to be careful in the meme type of world where, putting small bits of information that can be viralized really quickly without sources attached, without anyone, posting pushback on that information. So we are really big on that here at the Smart Center with making sure our platforms have that information. We partner with entities like the University of Tennessee and Tennessee Department of Mental Health and Substance Abuse Services so that, we are a full court press in ensuring that there are just as many sources available for those so that the general public gets used to and well practiced and well versed in knowing, okay, well, they might be one of those ones that does this versus that. And, just always having that information as readily available as possible and calling it out, whether it's in social media, whether it's in personal groups, but we have to inform ourselves with enough knowledge and certification and licensure to recognize that, because it is a mutating beast. There are always new kind of obsessions on certain disorders that people talk about for periods of time. For a while, as we learned more and more about ADHD, and it became the talk of the town, so many people started talking about their symptoms and things like that. And so they created spaces because people had high level needs, but those individuals, weren't properly trained. Those individuals weren't creating a space for help. It was mostly for self-promotion. And so when we see those types of things as practitioners, we warn people that we're helping. I know that you might be vulnerable right now, but just be aware of these types of things, be aware of these types of pitfalls, and so it just kind of keep an eye on the ball. And like I said, participating in projects like these definitely helps us raise our awareness. But that's a great question. I'm glad that you asked that. That was my last question for you guys. Do you have any final just thoughts or comments that you'd like to share?
Thank you for having us.
Yes, thank you so much. I really, really appreciate it. You guys gave so much good information and feedback that I know whoever is watching will be really, really deeply appreciative from knowing that it's okay to pivot early, even though you made a pick, or even if it was a legacy choice because our parents were in the field, like that is an assurance that I know so many need. And then of course, sharing your thoughts on, what really makes up behavioral health and letting us know, how deeply committed we need to be to being open to across cultures, across ethnic groups and things of that nature. And then certainly sharing just your personal thoughts and experience, I think will go a long way for any new high school student or re-engaging non-traditional student who might choose a behavioral health field. So I really appreciate your time and I thank you so much. And you guys have a good rest of your day.
Thank you so much. Thanks for having us. Bye.
Bye-bye.
Thank you so much for tuning in to listen to our podcast, brought to you by the Smart Connections podcast from the Smart Center at the University of Memphis, as well as the Pathways to Behavioral Health Careers Project. If you or anyone you know needs any information from the Smart Center, please contact us at 901-678-1636 or email us at smartcenter@memphis.edu. You can also learn more about us at our website, memphis.edu/smartcenter.